Kilakasla Nuguam Golasium. That is the name that my grandmother gave me in our family's first potlatch from the killer whale clan from Alert Bay, the Numkees Nation. I'm so grateful to everyone who's taken the time to be with us this morning, this afternoon, wherever you may be right now. And I'll just ask us all for a second to just put your feet on the ground and give yourself lots of grace and care for taking the time to be here today. There is so much going on in the world, and I'm so grateful for Bernice to start us in a really good way and thinking about the prayers that are so important for our communities and for the work that we do. I'm also really grateful for the National Collaborating Center for Indigenous Health, who's worked so hard to get us to this point, and just all of the organizing that comes with this. So hands up to everyone who is here today. I'm very grateful that Bernice is here to share her wisdom as a practitioner, and just also really want to acknowledge all of the individuals who contributed to this work to be able to talk about this interface of Indigenous knowledge and evidence-based practice, what we typically would see in Western knowledge bases. So I'm coming to you from the homelands of the Squamish and Musqueam peoples, and my family teaches me that when I am in other territory that I declare my intention, and I'm here to share some principles that my family tells me about just going into the world with compassion and protection. And that is part of the name that my grandmother gave me. I'm hoping that everyone is feeling compassion and protection for themselves and their families and their networks around them in really troubling times. So again, really grateful for everyone who's made the time to be with us today. And I'll just ask Sophie to introduce herself.
Hi, everyone. So my name is Sofia. I have been working at Reciprocal Consulting for about 5 years, and I've had the pleasure of being a part of many different projects and witnessing a lot of different worldviews, especially through this project. And yeah, so my ancestry is from Colombia, South America, where I'm a Mestiza woman and a Latina woman, and I am a settler here in Vancouver. I was born on Squamish territory. And right now, I'm on Commercial Drive on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh people. So thank you so much for being here and for being present.
So we have the enormous honor of sharing some of the work that we had the privilege of working on with the National Collaborating Center. And on this first slide, you'll see a quote that really emulates what a lot of this report is about. So the report that we're going to talk about is the report that is on the website for the National Collaborating Center at the interface Indigenous Health Practitioners and Evidence-Based Practices. And just as in terms of some background, Indigenous health practitioners have faced unique challenges in delivering evidence-informed services to their Indigenous clients. So the purpose of this project was to explore some of the barriers that exist in blending Indigenous and Western knowledge within the healthcare system, and think about some of the wise practices that we've learned from practitioners in applying Indigenous informed health evidence, not only in the practice, but also in decision making. So the project included conducting a literature review and then also semi-structured phone interviews with Indigenous health practitioners. And we also hosted an online survey delivered to Indigenous health practitioners as well. So all participants provided their consent before participating in this research and were advised that their participation was confidential and voluntary. And before we get into the findings, one quote that always stuck with me from the literature was, "Evidence is never gained in the absence of a specific interest."
Evidence-based practice looks different for Indigenous methodologies and Western methodologies. So one of the focuses of this research was looking at what constitutes evidence-based practices for different individuals, different cultures, different communities. So in our findings, examples of Indigenous methodologies included experiential learning, observation, storytelling, learning from elders, and also learning from knowledge keepers. So while examples of Western methodologies include different things such as randomized control trials, population-based statistics, and published findings. An overarching difference between both of these methodologies is that Indigenous methodologies tend to conceptualize knowledge holistically in the context of the larger picture, whereas Western methodologies tend to break evidence down into individual pieces, separate and siloed from the whole to be examined individually. Indigenous evidence-based practice, unfortunately, as many of our listeners know, being devalued by Western knowledge systems that tend to operate under the assumption that Western knowledge is the most trustworthy source and that this is the only single truth that can be discovered, which is, of course, the underlying beliefs of the positivist system. The idea that Western knowledge systems are the correct and only way to understand the world are reinforced for health practitioners, both in the medical education system as well as in the healthcare system as a whole and in practice. So in addition, Western research methods have frequently been exploited, have frequently been there to exploit and harm Indigenous peoples. And Indigenous people are the most studied populations in the world, which, initially might sound like a good thing, but until recently, none of that research has actually brought benefit to communities and Indigenous nations. Participants in this study reported making use of both Indigenous and Western forms of evidence-based practice. And they also really acknowledged that Western evidence-based practice are frequently perceived by their colleagues in their workplace to be superior to Indigenous evidence-based practices.
So when we were talking about access to evidence and gaps in knowledge, participants indicated that they preferred to access Western knowledge and evidence via kind of the standard ways of the internet, published literature, such as journal articles or conferences. And they reported that they preferred accessing traditional knowledge from elders and knowledge keepers through conversations and storytelling, which is probably not surprising. Participants reported that they access traditional knowledge also in person and via the internet. And with regard to Western knowledge, participants identified gaps in areas such as traditional medicine. There's definitely a gap in understanding how we blend Indigenous and Western medicine in healthcare practice, which is, I think, why the Collaborating Center has the vision of trying to understand and work toward understanding this more and having more research specific to Indigenous populations. So participants stated that they would like more Indigenous-led research, they'd like more strengths-based approaches in research, and more research on indicators of wellness as opposed to deficit-based indicators. We also found that there is a support for blending traditional knowledge into practice, that there is actually not a support, that it's generally lacking, and that there is an increased desire to access traditional knowledge, and that there's a need for more training with medical students earlier on to understand the history and colonial violence that's happened in our communities to prepare medical students for working with our communities.
So the next section here is about the incorporation of traditional knowledge into healthcare practice. So participants were asked whether they incorporate traditional knowledge into their own practice. And we got a few different answers for this, but the majority of participants indicated that they do use traditional knowledge in their practice, with many qualifying their responses with answers like, not as much as I would like to, or when it is requested. So examples of Indigenous practices that participants have engaged with is inclusive of deep listening and knowledge sharing with clients, families, community, and colleagues. So as we know, practicing culture and practicing traditional culture is not just, cultural activities as a lot of colonial lenses see, but it's a whole plethora. So engaging in relation is a really important part of culture, and practitioners did talk about this. Also incorporating traditional teachings into practice, such as the Anishinaabe 7 sacred teachings, and of course the medicine wheel from the prairie that's used in many parts of Turtle Island, as well as incorporating traditional medicine or ceremony into their practice. As well, some participants spoke about supporting cultural competency in practice, such as bringing in traditional foods, following protocol, involving elders and the community in practice, and also taking a holistic approach to healthcare. So that kind of speaks to those traditional teachings again. It's also worth mentioning and noting that the workplace culture impacts the extent to which Indigenous healthcare practitioners feel able to incorporate traditional knowledge into practice, which of course makes a lot of sense. So with many expressing that the healthcare environment is generally not supportive of blending Indigenous and Western knowledge systems, participants reported experiencing racism from colleagues, Indigenous knowledge being devalued, and Indigenous practices being considered too time-intensive in an environment where pressure for work and efficiency is more valuable.
Sophie identified some of the barriers, but we did ask intentionally some of the barriers to blending Indigenous knowledge into Western systems and mentioned racism. And the reality is there is epistemic racism where we have the domination of one worldview over another, and that there is a lack of value placed on Indigenous knowledge and Indigenous methodologies, and it's just often not seen as legitimate. And this is particularly problematic because it manifests in resource allocation. It determines who gets compensated for their work and how much. Indigenous knowledge keepers are not always compensated for the ancestral and traditional wisdom that they bring to a workplace, or whether to provide resources for technical upgrades or traditional healing spaces in clinical settings, like such as a sweat lodge or the like. Racism in the workplace does delegitimize Indigenous knowledge and practice, and it's frequently reinforced by workplace culture and deeply ingrained patterns of beliefs about what constitutes evidence-based practice. Related to this, Indigenous, like Sophie was mentioning, Indigenous practitioners fear being judged by colleagues.
Yeah, so adding to what Kim was mentioning, even I remember throughout the process speaking to the practitioners, because I had the privilege of doing many of the interviews. And even if there were some policies where kind of at face value things were okay to practice, like smudging, sometimes there was that kind of workplace culture that made it really hard to be vulnerable and to share those gifts of teachings and everything. So it's such a complex issue that even when things are written down, it really needs to be put into practice to support and to celebrate that. So continuing on with a bit more barriers, blending the knowledge systems, some additional barriers included a lack of support from institutions to integrate Indigenous knowledge into healthcare, as we have spoken of already a bit too. And related to this, Indigenous practitioners really felt exhaustion due to the burden of being a lone advocate for healthcare and for Indigenous health in that healthcare environment. So there was also fear of commoditization of traditional knowledge. This was a barrier for some. For example, folks were worried about the documentation of traditional practices, as it's a huge risk of cultural appropriation and breaching protocol from elders and from people's communities to write these things down and not know what hands are going to take these teachings. So Indigenous peoples are often viewed as a homogeneous group where data on all Indigenous peoples is aggregated. This means that individual strengths and challenges are really being lost in the process of pan-Indigenization. So it really doesn't work to have that one-size-fits-all approach. Of course, Indigenous people in Canada are extremely diverse. Therefore, it's so important that Indigenous knowledge is understood within the unique context, language, and the land that knowledge exists on. Finally, for non-Indigenous colleagues, it was frequently assumed a certain level of expertise and even demanded from their Indigenous colleagues in translating or incorporating Indigenous knowledge into practice, despite the fact that, for the most part, Indigenous peoples have been educated in the same Western institutions as their peers and can't have that assumption to have the experience or exposure to Indigenous knowledge systems. It's a huge disservice and act of violence to assume people have traditional knowledge systems when colonization has, existed to take that out of people and to take that out of communities.
Thank you, Sophie. The group that we were able to interview and the feedback that we received through the online survey definitely demonstrated so many wise practices to integrate Indigenous knowledge and just enormous leadership from practitioners across Canada. Most participants reported that they were able to bring their full self into their work in the healthcare system and that it is feasible. And they actually, in their experience, saw that the healthcare system was strengthened by bringing in their knowledge system and just having the two systems complement each other. They did talk about a need for some cultural sensitivity and safety for the two systems to be blended well, but they did see that it has in some settings. And they also talked about the two-eyed seeing approach that Albert Marshall articulated about valuing Indigenous knowledge equally to Western knowledge and understanding that Indigenous knowledge is integral to the health and well-being of Indigenous people and it's equally valuable. The other thing that participants noted was having buy-in from senior leadership in the healthcare system made a huge difference when they were able to work collaboratively with the leadership.
So more wise practices that came out include building relationships and partnering with Indigenous communities to integrate Indigenous knowledge into those local healthcare settings. So, for example, seeking guidance from the community on how to best ensure trauma-informed care and cultural safety in practice within that local community context. We had the privilege of working with a group in northern BC that really took this to heart and was able to incorporate a lot of teachings and cultural practices into some reports. And it really made disseminating that information to the community way more relevant and make a lot more sense and just be, more relevant to their own system of understanding. So furthermore, just to seek guidance from elders and knowledge keepers to provide guidance on blending those two knowledge systems in the healthcare system is really important because of the knowledge that they have. It was also recommended to develop protocols and guidelines for non-Indigenous people to engage respectfully with Indigenous leaders and communities. It is super important to ensure that tokenizing and that commoditizing isn't happening so that Indigenous practitioners are able to, be with their clients and patients as much as they can and don't have to be answering questions. So to have that protocol in place is really supportive for the whole team. Frequently, there is that lack of awareness on how to approach Indigenous communities in a respectful way, which, includes who to talk to and what is an appropriate ask. So in regard to research, it's also suggested to use decolonizing methodologies to engage in research about evidence-based practice. And there's so many resources, even on NCCIH to do that in a good way. So there's things out there, people just need to find them. Also, using Indigenous methodologies facilitates Indigenous knowledge being led, designed, interpreted, and shared by Indigenous people, which really adds to that self-determination and that equity. So finally, taking a holistic approach to healthcare that accepts the interconnectedness of mental, emotional, physical, and spiritual wellness, as well as the interconnectedness of the individual, the family, the community, the environment, and the cosmos and the universe in regards to health and wellness is absolutely key in doing this work.
Thank you, Sophie. In the report that's on the website, there is a discussion which kind of brings all of the points together about the gaps that exist, the barriers. I won't repeat everything that we've talked about, but will say that I almost feel like it's a call to action for anyone who's on the line who is a researcher, who is a practitioner, to think about how you can contribute to creating the space for really good practice, for, understanding that there are additional worldviews and definitely enormous benefits of having that holistic care for our communities. And just thinking about the need, for research going forward, there is definitely a huge gap in the medical curriculum with regard to including Indigenous knowledge, and just thinking about the work that you're doing and how can you contribute to increasing the number of Indigenous healthcare practitioners and researchers. So that would conclude our presentation, and we're really grateful that we have the opportunity to hear Bernice speak about her experience as a practitioner. So thank you all.